I commend and urge everyone to redouble their efforts to combat drug abuse and trafficking in the country. On this score, I wish to assure you of this administration's support. The renewed hope agenda places the youth at the center of its focus. Therefore, we shall ensure that our young people are protected from anything that could derail their future or destroy their potential. In the face of such a formidable challenge, prevention is the most potent weapon that we can deploy. Prevention not only saves lives, it also saves resources that would otherwise be spent on treatment and rehabilitation. It empowers individuals to make informed choices, promotes healthy lifestyles, and creates resilient communities capable of withstanding the pressures of drug abuse. Investing in prevention is not merely a moral imperative, but a prudent way of safeguarding our future. By allocating resources towards evidence-based prevention programs, we can break the vicious cycle of drug abuse and protect our youth from falling prey to the menace. This government will support NDLEA to build on the success recorded in the past few years. We shall work with all relevant stakeholders to ensure that we have positive statistics from the next National Drug Use Survey that will be conducted in the country. Together we can build a country where every individual has the opportunity to live a drug-free life.
The test is intended for secondary school students, students seeking admission into tertiary institutions, and returning students, workers in government and private offices, and individuals seeking political offices, as well as prospective couples before taking their marriage vows. The drug test will serve as a tool for the prevention of drug use and early detection of the individual's status of drug use for the purpose of appropriate intervention, including treatment and rehabilitation. Let me also add that our drug integrity test, which has been adopted by some government institutions and tertiary institutions in the country, is a preventive mechanism. This is for use in homes, schools, workplaces, and others. Apart from helping in early detection of drug abuse, especially by our youths, so that we can get them help in form of treatment, this will also create some deterrence effects.
Nigeria needs to invest more in prevention, with a strong focus on children and youth, in particular girls and women, young women. Therefore, allow me to recommend, after the exceptionally successful testing of the school-based drug prevention program Unplugged, involving 500,000 school children across Nigeria, the program should be rolled out to all 28,000 public and private secondary schools. Secondly, we need to enhance the resilience against drug use among the millions of out-of-school children, for example, through sports-based initiatives such as the Line Up Liver program. Furthermore, we need to strengthen families in their ability to recognize and address drug use effectively and in constructive ways. We need to expand the training of those coming typically into contact with drug users, such as law enforcement officials, traditional and community leaders, and, very importantly, primary healthcare workers.
The most important place where this prevention fight starts from is actually the education sector. And we will do our own part. Even last week, it was something we considered, the policy to review the existing policy on it, so that we can work with NDLEA to take it to secondary schools and primary schools. To establish at those levels compulsory and sustained testing